You know, you can hardly pick up a newspaper or a magazine anymore without seeing an article about sleep breathing disorders, the most common of which is sleep apnea. Well, the reality of it is sleep breathing disorders are truly epidemic in this day and age. I think they've been there all along, they just haven't been recognized. We used to think it was just old fat guys that suffered from sleep apnea, but now we know that it's women of all ages, and we're even finding it in young children. In fact, some of the research out of the University of British Columbia has indicated and shown that children that have been diagnosed with behavioral disability, behavioral problems, and learning disabilities may well be suffering from sleep disordered breathing, sleep apnea. Perhaps you yourself have been told that you snore or that you stop breathing when you're sleeping, and you may be suffering from sleep breathing disorders. If so, if you have any of those symptoms, I strongly urge you to get yourself checked. But what do you do if you have it? Well, some of you who have been diagnosed with it have a CPAP unit, continuous positive air pressure system, and those work extremely well. The problem is that some people have trouble tolerating it. In fact, some of the research has indicated that there's only about 50% compliance wearing a CPAP unit after 1 year. This is a problem because if these people are not wearing the sleep appliance of some type, that they're putting themselves at significantly higher risk of death from sleep disordered breathing. So, if you have a CPAP, are you wearing it? Are you wearing it every night? Are you being monitored to know that it is set correctly? All of these issues are very, very important. It's not just a matter of putting on a CPAP unit and living happily ever after. What are some of the options to CPAP? If we have people who don't like wearing a CPAP, they've tried, they've failed, what are some of their options? Well, the best options now are oral appliances. And there's oral appliances that have been approved by the FDA for sleep breathing disorders. And quite frankly, they work very well. We're finding that they're very useful in people who just for whatever reason cannot or will not wear CPAP. But we're also finding a niche in that people who do a lot of traveling or people who like to go camping and they don't have some place to plug in their machine, they're finding that oral appliance therapy works very well. The good news is that the research has shown that we can switch from oral appliance therapy back to CPAP without any risk. So how does an oral appliance work? Very simply, it brings the jaw forward, it pulls the tongue away from the soft palate. That opens the airway and allows air exchange. Now, you say, well, we can get an appliance at the local drugstore. The problem with that is it is not FDA approved, it is not adjustable. Just like a CPAP unit, it needs to be adjusted, it needs to be monitored, and we need to verify that it is indeed doing what we want it and need it to do. So, is it for everyone? No, absolutely not. The CPAP is still the gold standard. But the oral appliance gives people a very viable option to use when they're traveling or when they're camping, or if they just choose not to wear a CPAP. We can do an examination to see if you are a good candidate for oral appliance therapy, very simply in office. So if you would like more information, if you would like to have a consultation to see if you are a good candidate, please don't hesitate to contact Expressions Dental.